As a specialist, I do not focus on my client's symptoms. What is it like to be an anxiety specialist? For myself, it is very frustrating to be an anxiety specialist when I'm treating clients and I'm doing everything that has to, do with running my practice. I am absolutely loving it. Outside of that, it is very frustrating to be an anxiety specialist because the general consensus of how to treat anxiety is very frustrating. We live in a world that really focuses on symptoms over getting to what people would, in a cliche way, call the root cause of the issue. As a specialist, I do not focus on my client's symptoms because we are just basically, it's a fool's errand, as people used to say a long time ago. So maybe I'm dating myself. When you chase symptoms, essentially what you're doing is not only are you putting a Band-Aid on your anxiety, you probably are actually worsening the anxiety. By being so symptom focused, you are robbing yourself of the ability to be able to handle your anxiety in a very skillful way and also in a very confident way. So that's what really frustrates me as a specialist, is just seeing how many things out there are focused on getting your symptoms down. Take this, do that, do this, that helps with anxiety, mushrooms, medication, try this tea, try this breathing device. All that basically reinforces that you are not the person that can handle your anxiety. As a specialist, I walk my clients through a very skilled approach, an advanced cognitive behavioral therapy program that allows them to become very flexible to their anxiety, to the point where the symptoms are not that distressing to them anymore because they've learned how to handle them. They've changed their mindset about how they think about their anxiety, and they changed their behaviors and how they respond to their anxiety, which ultimately makes them highly resilient towards their anxiety. And that is really a much better way of going about treating anxiety, because you are now empowering a person to be able to not depend on symptom reduction as a method to deal with anxiety. So as I'm watching TV and I'm scrolling social media, just being bombarded with all these products that mean well, that are focused on symptom reduction, but actually really make people more vulnerable to anxiety. That's what frustrates me as a specialist. So as always, thank you for stopping by, and take care.